I would like now to introduce Patrice Nagel. She introduced herself, but I'd like to welcome her to her first RCBA meeting, where she's gonna actually talk to us about Cal-OSHA and COVID-19 emergency regulations. We all hope that the light is at the end of the tunnel and that hopefully we'll all be able to get back to our workplaces. But there's a few things that every employer and business should know about before making that transition. So Patrice.
Well, thank you, Carolina, and thank you.
Yeah.
Welcome. I'm really excited to be here. This topic that I'm about to speak about is the most it came quickly, and now employers are having to deal with it on a really expedited basis, as if the end of 2020 wasn't bad enough. All of a sudden, you had Cal-OSHA slapping down some really draconian restrictions and regulations on employers that they needed to comply with immediately. And it just made it so that it's been a scramble. And all the employers are having constant questions, and COVID-19 and employer relations with employees has really been somewhat of a moving target, and this has just sort of further complicated that issue. So I have a little slideshow presentation that I'll put up, and so I'll screen share, probably pretty clumsily, but let me see if I can do that for you.
Yeah.
Okay, can you all see this?
I can see it.
Everybody see that?
Yes.
Okay,
yes.
Great.
Okay, thank you.
So there's a lot to digest here, and we have sort of a short time frame. So I tried to break it up as sort of concretely as I can for you, with what the hard law is, and then what some suggested action plans are for employers, just so you have some tangible, helpful tips to walk away, hopefully, from this conversation. Let's go. So here's me. If you have any questions after this presentation, obviously feel free to reach out to me if you have any questions. We as a firm, have been kind of on the ground, working nonstop, 24 hours a day, to try to get forms ready and everything else. And you'll see in my presentation that there's a lot of different notice requirements that are now being put forth by Cal-OSHA that weren't necessarily in place before. And so what we have are template forms ready to go, kind of like a ready to go playbook for employers, and how to deal with these certain situations. So if you want help, if you need any extra questions later, feel free to reach out to me. Okay, so what I'm going to cover today is sort of a background of how we got here, who is covered, so who needs to worry about these new Cal-OSHA regs, a 9-step compliance blueprint for you, and then conclusions and next steps. Okay, so we have this emergency temporary standard. It was floated pretty early, pretty late in the year, so in early November, and then quickly by November 30, 2020, that's when it went into effect. So right now, it's in effect for 180 days, but it could be extended. So it's active. Employers currently are required to comply with it. So who does it apply to? It applies to everybody, with some very limited exceptions. So there's no minimum cutoff of how many employees you have or anything else. It applies across the board to all employers, except with these small exceptions. And those would be if you have a place of employment where there's only one employee. That's kind of obvious, right? If people are working from home, then they wouldn't apply under this regulation standard, or then other employees who are already covered by the aerosol transmission standards. And that usually applies to if you're in certain healthcare facilities, laboratories, et cetera. But that's it. Everybody else needs to listen and needs to comply. Okay, so the first takeaway of what's required under these new regulations. The first one is that you have to have a written, and that's sort of key underline, written COVID-19 prevention plan. Most of you or all of you should have some sort of injury and illness prevention plan. And then this is just a tack on, right? You can either have it and integrate it into whatever current an injury and illness prevention program plan you have, or it could be a standalone document, but nonetheless, it needs to be some sort of plan. And what that means in reality is it's a plan that you communicate to your employees about how you're going to handle things, right? What are your standards? How do you expect them to communicate with you, et cetera? And the Cal-OSHA has put together some requirements, and these are the key ones that are required to be included in this written plan that you're going to have in place. One is you have to identify and evaluate COVID-19 hazards. You need to discuss how you're going to investigate or respond to COVID-19 cases in the workplace. You need to have in place some form of training and instruction for your employees. Part of that packet that we have has a PowerPoint presentation that you can give to employees, but it's important in whatever form it is that you kind of educate them on what is in your plan so that they understand and know kind of how to respond to it. Physical distancing and face coverings, how they're going to be distributed if you're distributing face coverings, et cetera, and what's expected in terms of physical distancing. And we'll get in the weeds a little bit more about what the regs require specifically, but this is what needs to be in this plan. You need to talk about how you're going to exclude COVID-19 cases if they become known to you, and then any return to work criteria that your company is going to require for employees to come back. So what you should do next is you need to make sure that you've got one of these written plans in place. And then you also have to assess what changes may need to be made to the existing plan to make sure that you cover all these different things. Sorry to harp on it, but it's just my experience. In our little packet, we have a sample plan that employers can use to then use as an addendum. So it's already been drafted. Okay, takeaway number 2, a notice of COVID-19 exposure in cases. So as an employer, what are your obligations if you have notice of a COVID-19 exposure under these new emergency regulations? Okay, so if you get a note, well, so also, what about AB 685? So I don't know if all of you were aware that prior to Cal-OSHA kind of creating these mandates and creating these rules, we also have Assembly Bill 685, which then now has become active as of January 1st, which sets forth notice requirements. And that all leads into whether or not, if you know of a COVID case, that you need to make sure that you notify the employer, the other employees that are the work site that may have been exposed, and then potentially outside agencies that are required to have knowledge. So we'll talk about the overlap between AB 685 and then Cal-OSHA. There is a lot of overlap, but in some respects, one is more strict than the other. In AB 685, there's more requirements for who needs to get notified, but then with the Cal-OSHA requirements, there's far more notices that need to be disseminated. So we'll get into that in a second. The notice of disinfection and safety plan, confidentiality requirements are pretty much the same in terms of you don't need to disclose who it is that has the COVID test. And then a notice to the local health department when there is an outbreak. So there's some overlap there. Okay, here's the deal. When notice is triggered, so COVID-19, if you have a case in the workplace, they must be investigated and responded to. So let's say somebody comes to you and said, okay, I tested positive and I was, in the workplace during what would quote unquote be called the infectious period, which would have been at least 48 hours before their symptoms showed up. If they have been in your workplace, then you need to investigate. You need to make sure where they went to, who they spoke with, who they potentially were close to, and kind of make a web of that information so that you have knowledge of who potentially may need to be notified. So did they eat in the break room? Did they go into the bathrooms, et cetera? You want to make sure that you trace their activities. when we talk about work sites or work locations where there's potential exposure, that doesn't mean, let's say you have a compound that has multiple buildings. If that person only went into one building, only that building would be affected. You wouldn't have to then, the work site doesn't extend to the other buildings that that employee potentially went into. It would be the work site where they are. So a COVID-19 case, how is this defined under the regulations? So it's somebody who's tested positive, who is subject to a COVID-19 related order to isolate issued by a state health official or has died due to COVID-19. And what does it mean to be exposed to COVID-19? COVID-19 exposure means being within 6 feet of a COVID-19 case for a cumulative amount of 15 minutes or greater in any 24-hour period within or overlapping with a high-risk exposure period. So that's that time where it could be up to 48 hours before the symptoms showed up. I feel like just from reading the news and everything else that we all have become pretty well versed in these expectations, kind of sadly, more so than we probably would care to be. But this is how Cal-OSHA is defining this. And what does it mean to be in an exposed workplace? So an exposed workplace is any work location, working area, or common area at work used or accessed by a COVID-19 case during the high-risk period. So this includes bathrooms, walkways, hallways, aisles, break or eating areas, and waiting areas. But like I had shared before, this doesn't include buildings or facilities that COVID-19 case did not enter. Okay, so when you do get notice of somebody having a COVID-19 case and that they were at your facility during the highly infectious period or during the infectious period, what's required by you? And this is where it gets pretty pretty unbelievable that these requirements are really stressing employers. So what you're required to do is you're required to provide notice of a potential COVID-19 exposure within 1 business day. And that's what trips up a lot of people, is trying to get that turned around within 1 business day. So what has to happen is you have to have knowledge of the COVID-19 infection, have done all that investigation and tracing to figure out who potentially could have been exposed. And then you have to also provide a notice to all employees who may have been exposed to that case. Any authorized representatives, that potentially could be any union representatives that they have that would need to be contacted. And then it doesn't only limit itself to employees. It also extends to independent contractors and any other employers who are present during that high-risk exposure period. And also then you may need to provide local health department information or a notice if you have an outbreak. And we'll go into the definitions of that but in a couple slides. But you just need to know that there's different layers that you need to provide. For an outbreak, you would need, just quickly, to have, there's 2 levels of outbreak. And one, you would need to have 3 within a 14-day period or 20 within a 30-day period. And there's different testing requirements that are associated with those. So what should you do about these notice requirements? You need to have an effective procedure in place to deal with these cases in the workplace. So this would be part of that injury and illness prevention plan addendum with the COVID-19 in mind. So how you're going to investigate, verify, identify, record, and you just want to have template notices in place. So that 1-day turnaround isn't impossible, that you already have them ready to go. You just need to get them out the door. So that's something that you want to make sure that you're prepared for. Okay, so takeaway number 3 from these new regs is physical distancing. What's that mean, and what are they requiring for you? All employees need to be separated by 6 feet, except where the employer can demonstrate that 6 feet is not possible, or momentary exposures when the employees are in movement. I think it would be, an employer would be sort of hard pressed to show that 6 feet of separation is not possible. I think that you want to err on, if you can, in any in any way create that 6 feet of distance. I know, like maybe in like industry where people are packing things, or where the people need to stand close together, you just need to make sure that if you can't do it, so if an employer physically can't do it because of reasons like that, you need to make sure that they're as far apart as possible, and you want to be able to defend that if somebody challenges that. And then for fixed locations where it's not possible, you want to create, and it says in the regulations, cleanable solid partitions. So that would be sort of the way that you would try to ameliorate any possible transmission if everybody for sure needs to be within that 6 feet distance. You also need to implement cleaning and disinfecting procedures. So you want to identify and regularly clean frequently touched surfaces such as doorknobs, elevator buttons, equipment. You need to prohibit sharing of PPE. People can't be giving each other their masks or anything else. To the extent feasible, you need to prevent sharing of items such as phones, keyboards, instruments, and tools. And sharing of vehicles shall be minimized and high touch points disinfected between the users. So just all things that are highlighted in the regs. So what should you do about the physical distancing? You need to make sure that you or your managers or anyone else who's sort of the eyes and ears of the company are making sure that these are being followed, and that what is being done meets these requirements. You could review the physical layout of your building. I know that some people have implemented one-way hallways or different ways of laying out the work so that people aren't within these spaces. You need to consider maybe a variety of physical distancing methods, such as staggering the schedules, or other types of creative actions to make sure that this is followed. And then you need to implement cleaning and disinfecting procedures, especially regarding the common or shared equipment. So in the lunchroom, in the break room, in the bathroom, and all of these should be part of that written plan that you have in place. Okay, face coverings and PPE, number 4. So you need to provide face coverings under these regs and ensure that they are worn by employees over the nose and mouth when they're indoors or when outdoors and less than 6 feet from somebody else. And then also when required by state or local public health department. And they've made it very clear in these regulations that face shields aren't a replacement for face coverings, but they can, if you have a mask, you can also wear a face shield. But this is a mandate. You have to provide them to them. There's no gray area here. Employers, as part of this regulations, are required to give it to them. The only exceptions are when an employee is alone. If that employee is eating and drinking at the workplace, but you want to make sure that even when they are doing that, that they're still within that, there's still that 6-foot barrier. Employees wearing respiratory protections, employees who have a medical or mental health condition or disability, or hearing impaired, or specific tasks where it can't feasibly be performed with the face covering. Here, as in any disability or any issue where an employee has an inability to comply with the rules due to some sort of medical reason, you need to, as an employer, engage in that interactive process, speak with them, see what solutions you can come up with them, and accommodate them as you would any disability. You need to, even though it hasn't been litigated, COVID-19 and somebody suffering from COVID-19 can arguably claim to be disabled. So you need to make sure that that triggers for you all of those normal steps you would take if somebody had a disability in the workplace. Employees exempt from face coverings shall wear an effective alternative, such as a face shield with a drape. And an employee not wearing a covering shall be at least 6 feet apart, unless the unmasked person is tested at least twice weekly. So that's sort of the caveat, and that's the exception that the regulations allow for you. So let's say you have somebody that you can't accommodate for whatever reason, they can't wear the mask, they can't be 6 feet apart, and you're like throwing up your hands, okay, so what now? As long as they're tested at least twice weekly, then that could potentially be a solution, but that's obviously a last resort. You can't prohibit employees from wearing face coverings unless it would create a safety hazard, and you must evaluate the need for PPE gloves, goggles, and provide that as needed. So what should you do next? You need to implement face covering requirements and disseminate it to employees. Evaluate and document exemption requests on an individual basis. If the exemption does exist, make sure those employees are 6 feet apart or tested twice weekly, and then review whether any additional PPE is needed. Okay, so what do you do when you have somebody who is has COVID and they've exposed these people? What now? And this is where the rubber hits the road in these regulations. So employers shall ensure that the cases are excluded from the workplace until the return to work criteria, which we'll talk about in a couple minutes, is met. So reminder that COVID cases are those who have tested positive, ordered to isolate, or died. The only exception is as long as they haven't been isolated by the public health officials, the employees do not need to be excluded if they are assigned to other work where they don't have any contact. So what do you have to do? You shall include, so there's no wiggle room, employees with COVID-19 exposure from the workplace for 14 days after the last known exposure. So that not only includes that person who you know tested positive, but all of those people who were within that exposure, who were potentially exposed to them because they were within those parameters of being with them within 24 hours for at least 15 minutes. So for employees excluded from work, and this is where the policy has become very harmful to employers, and there's already been multiple lawsuits that have been filed challenging this, but they need to be paid. So you need to make sure that you continue to pay all of those employees, so the one that tested positive, and then all of those that you're now required to exclude from the workplace for 14 days, you need to make sure that they continue to be paid fully, that their seniority doesn't become affected, that all other employee rights and benefits remain the same, and then the right to their former job status remains the same. The employers may use their employer-provided sick leave and consider benefit payments from public sources, but it's still a little gray area there. So you can just imagine that this could be very costly to employers. And also, based on these regulations, there doesn't seem to be any limit. So where we saw earlier in the year where we had paid sick leave that was granted additional paid sick leave for people who needed to be out due to COVID-19, but it limited it to 80 hours. Here, it's unlimited. So somebody conceivably could be exposed to COVID, be out with full pay for 14 days, come back, work, and then that next day they come back to work, be exposed again, and be again out for another 14 days paid until they're able to come back. So it's, and the lawsuits are really focusing on OSHA and their authority to create this mandate on employers because, where does that come from? And because it has been approved, there is civil liability right now for employers who don't comply. So it really does have teeth, and employers need to make sure that they're following it. 2 exceptions. It doesn't apply to any period of time during which the employee is unable to work for reasons other than preventing COVID-19 transmission. And it doesn't apply where the employer demonstrates that the COVID-19 exposure was not work-related. So those are your 2 kind of saving graces. So what should you do next? You need to develop a protocol and procedure regarding when to exclude COVID-19 cases and exposures. You need to make sure you communicate those requirements to your employees. You need to evaluate whether paid time off provisions apply or possible exemption exists. And then you need to watch for these potential legal challenges to hopefully get those lessened. Okay, general testing rules. Testing requirements. So this is when we're not in that an outbreak scenario. So if you have 1 case in the workplace, somebody comes to you, oh gosh, we've got 1 person. So you must then offer free COVID-19 testing during the working hours to all employees who have potential exposure in the workplace. So those who are within the 6 feet of distance for 15 minutes over a 24-hour period, you need to offer to pay for that and give it to them. You shall inform impacted employees of the reason for the testing, but you can't use testing as an alternative to face coverings when face coverings are otherwise required. So for non-outbreak scenarios, you want to make sure that you develop a protocol for complying with the testing requirements. It's probably best to establish a relationship with your COVID-19 testing provider, maybe have a running account with them so that you can make sure that you can get people in quickly and probably cost effectively. And then you need to prepare notices to employees who are tested, explaining the reason for the testing and then the possible consequences of a positive test. And again, we have notices of that if that's helpful to you. We have those notices prepared. Okay, so what is an outbreak? And this is every employer's worst nightmare would be the outbreak scenario. So outbreaks, how they're being defined, and we'll sort of combine what's being required under AB 685 and the others. But under the definition of, under the Cal-OSHA reg, multiple COVID-19 infections and outbreaks is a place of employment that has been identified by a local health department as the location of the outbreak, and there's 3 or more COVID cases in an exposed workplace within a 14-day period. That's the multiple outbreak. Then we also have the major outbreak, and that's when there's 20 or more COVID-19 cases in an exposed workplace within a 30-day period. So multiple COVID-19 infections and COVID outbreaks testing requirements is you must provide COVID-19 testing to all employees at the exposed workplace during the period of the outbreak or that relevant 14 period. So it gets broader, right? It's not just those who had potentially been exposed. Testing must be free, offered during employee work hours, and conducted immediately on outbreak. Employers must offer same testing again 1 week later from some employees. So you can see that this is could be extremely costly for employers. After the first 2 COVID-19 tests, continuous testing of employees who remain at the workplace at least once per week or more frequently if recommended by the local health department. And there's no real clear guidance as to how long that needs to be going on, but that's the requirement. If you have a major outbreak, so that's the 20 within 30 days, you need to make sure that you provide testing to all employees present at the exposed workplace during the relevant 30-day period and to remain at the workplace. So the testing must be free of charge, offered during employee work hours, and conducted twice a week or more frequently if recommended by the local health department. So other requirements, you need to provide specific notice to the local health department within 48 hours after knowledge of an outbreak. So this is different when you just have one. If you have an outbreak of either variety, you need to make sure that you tell the local health department within 48 hours. You also have to do a specific hazard assessment and correction criteria depending on the outbreak definition. And then you need to, the requirements of the applicable outbreak apply until no new COVID cases are detected in the workplace for a 14-day period. But that's difficult to ascertain. So that's the only guidance that we're provided. So what should you do next? You want to make sure that you evaluate requirements imposed when outbreak occurs. Have a protocol for testing, exclusion, investigation, assessment, correction, and notices. Okay, returning to work. COVID-19 cases with symptoms shall not return to work until at least 24 hours since the fever of 100.4 or higher has resolved without the use of fever-reducing medications. COVID-19 symptoms have improved and at least 10 days have passed since the symptoms first appeared. Without symptoms, you cannot come back to work until a minimum of 10 days has passed since the date of the specimen collection of the first positive COVID-19 test. Order to isolate or quarantine. You can't let the employees return to work until the period of isolation or quarantine is completed or the order is lifted. And if there's no period specified, 10 days from the date the order to isolate was effective, or 14 days from the date the order to quarantine was effective. You cannot, and this is underscored in red for a reason, you cannot require a negative COVID test for an employee to return to work. seems somewhat contradictory or difficult to sort of remedy, but it's very clear in the regs that that can't be a condition of returning to work. Possible exemption for critical infrastructure workers. If there's no violations of local or state health orders, Cal-OSHA may, upon request, allow employees to return to work on the basis that the removal of such an employee would create an undue risk to a community's health and safety. So that's the one sort of caveat. If returned, employer must implement effective control measures. So what should you do next here? You want to develop protocol for applying return to work criteria to those COVID-19 cases. You need to communicate to employees, including at time employees are sent home. You want to develop a system for requiring employees to confirm return to work criteria have been met. Okay, last one, and this may not apply to all, but employer provided transportation. If you are a company or an employer that provides transportation, this applies to any employer provided motor vehicle transportation. You must ensure physical distancing, 3 feet, and face coverings. You must screen your drivers and your riders. You must keep windows open and outside ventilation. You must have hand sanitizer as required before entering and exiting any employer-used transportation. If you have housing, you need to implement priority housing based on individuals who work on that same crew or shift. Ensure physical distancing. Beds have to be 6 feet apart and no bunk beds. Cleaning and disinfecting at least once a day. And if a resident is exposed, you must isolate with a private bathroom, sleeping area, cooking, and eating facility. If you provide employee transportation or housing, you just need to make sure that you're doing all of those requirements. You also need to provide training and instruction. You need to provide effective training and instruction to your employees on all of these policies and procedures, related benefits to which the employee may be entitled, such as the continued pay and benefits, etc. How you're going to prevent, including physical distancing and face coverings and good hygiene, the spread of the virus. Encourage hand washing. And if there's COVID-19 symptoms, you want to enforce the importance of not coming back to work. Okay, so you need to take action now because you don't want to be caught in a position where you're not ready because the turnaround time is so short. So that is all. I'm sorry it took so long. There's a lot of information to cover there.
Thank you so much, Patrice. We do have some questions currently on the chat, and I'm just gonna just call them out and then they can. Alan?
Yes.
You want to ask your question?
Yeah, so question with regards to the 6 foot distancing and the face covering. If you're in an office that's kind of an open space and you have physical barriers that allow you to keep the 6 foot distancing and the employee is in that enclosed area, but other employees are greater than 6 feet away, do they still have to wear the face covering when they're by themselves?
Yeah, I would honestly, just for protocol under Cal-OSHA. I think right now they're requiring all face masks and the 6 feet distance. The only exceptions they're making if an employee is by themselves completely. So I think if they're in a room with others, I wouldn't risk it. I would still have them use those masks.
Mm-hmm. Alan.
Yes.
You see me?
Yep.
In my office by myself. Doesn't matter. For our site, I have implemented that you wear it 100% of the time except when you are eating, drinking.
Okay.
I don't care if you go to the bathroom, you're in the stall by yourself. You wear it.
Okay. Nope.
Consider it kind of, I'm preventing the airborne exposure of whatever you might be expelling or shedding, because I can't tell if you have the virus or not.
Right. Okay. Fair enough. Thank you.
Can you, Rob, can you open your windows? I know it's super cold, but would you be able to? No.
No, my windows don't open. They're just
okay. Okay. All right. We have Sarah Gilman also with some questions.
Hi, thank you. A couple things. Are we going to get access to the PowerPoint?
I can absolutely send it to you if you want a copy
That
of
would
it.
be very helpful. Just, it's almost like I can see a to-do list happening right now. And there goes the weekend.
Patrice, if you prefer, I mean, you can send it, of course, directly to Sarah, but if you could send it to me, I can make sure that I just resend it to the people on this call and actually the entire RCBA community who couldn't attend. And this video will be available as well.
Okay.
I had a couple other questions. Are there, you said a packet or something, are there forms for the tracing that we need to do, like a checklist and something to fill out? And is there a template with the wording on how to notify an employee?
Yeah, so, we understood from employers that, I mean, this is an impossible ask, right, to try to put all of this together. So what we have in our firm, and other firms have it as well, but is a packet. So it's kind of like a, here you go, packet of all the notices you potentially would need, with sort of annotations about, okay, if you have this scenario, you do this. If you have this scenario, you have this. And then it has a memo to employers, kind of giving you the steps one by one of what you need to make sure that you do. So we have that available, for purchase, obviously, but that's something that we have available for everybody. And I know that employers, I've heard from clients that I haven't heard from for a long time are like, get me that packet, because it's just been something that everybody's been scrambling, especially for the end of the year where everybody was trying to deal with year-end issues already. So.
And do we just contact you directly for that?
Yeah, that's fine. You can just email me.
One more question, and that is when an employee has to be quarantined, either due to exposure, or they say to you, I've been personally exposed, I need to quarantine, can we require them to work from home if they are not sick?
Yes. So that's one sort of accommodation that you can make. You just can't allow them to be in the workplace for that period of time. Yes.
Okay.
But you want to be careful, right? You want to make sure if they are exhibiting any sort of symptoms, you want to be careful to allow them to have that time off, or to have the sort of ability to be sick, if that's the case.
I have two questions, Carolina, for Patrice. Thank you for the great presentation. First question is, what are the penalties for not doing this correctly? What are employers exposing themselves to if they're not ready for this?
Well, because it was passed in November 30th, before it had just sort of been guidance. So now there could potentially be Cal-OSHA civil penalties. So they could seek court, they could file a lawsuit against the company for failing to comply in San Diego Superior Court, and try to seek some sort of remedy. So in other words, it's unknown. It could be huge. Right. I mean, all of this is untested. And I think that, everybody had been kind of hit hard with the paid sick leave, additional paid sick leave requirements that were already put in place in 2020. And then now you have this sort of unlimited amount of potential payments of paid sick leave, quote unquote, that could go interminably. I mean, if you have one person that gets sick and you get somebody else that gets sick and it just becomes a snowball, you could have all these people out for an extended period of time and you're expected to pay for all of their pay and benefits. I mean, that's untenable, really. And so there's all of these companies and other constituents that are challenging it. Okay, so my second question is probably even more impossible for you to answer with the crystal ball being so muddy right now. But we're going to take, like Rob just gave us a great example of what they're doing at his workplace. But now walk us through, what does it look like at Rob's workplace 2 months from now, 3 months from now, where half of his employees have somehow gotten themselves vaccinated? And they're like, I don't want to wear a mask anymore. I'm vaccinated. Like, so what does that look like from Cal-OSHA's standpoint as we merge into this period where some people are going to be vaccinated, some are not, some are going to choose not to, or whatever? How does that all play out with these regulations? That's a great question. And unfortunately, I probably don't have a very clear answer, simply because we don't know how. We've been kind of trying to get ahead of that. So I have a vaccine presentation I could do. We're kind of looking at that next level, but Yeah, it's, right now we are talking about forms, we have either mandatory or voluntary. You need to worry. I think where the issues are going to come from those questions is what you're saying right now. I want to wear them. You can still mandate masks or that to your workforce if that's the case. But at the same time, accommodation questions. That's where I think we're really going to have issues, is we're going to have those people that are going to say, I don't want to take the vaccination for religious reasons, or I don't want to take the vaccination for X, Y, or Z. And you as an employer are going to have to figure out how you accommodate that, what your requirements are going to be. Waivers are going to be a big deal, right? Where you're going to have your employees sign waivers, which are going to sort of prevent you from having liability for any contracted COVID-19 cases that occur. But the vaccine question is still such an open question right now. We have some guidance, but it's going to just see how we play out more down the road.
I have a question, Patrice. So really, I mean, if there's an outbreak at a workplace, like when there's like 3, 4, a lot of people, like, is there a penalty for the employer? Like, or is it just like, oh, okay, there was an outbreak and now we take control from now on? How does that work?
No, there's not necessarily a quote unquote penalty for the outbreak itself. But if you fail to follow those different requirements for having an outbreak, then yes. So that you don't notify the public health, you don't offer testing as required by the regs immediately to all the employees at the work site, et cetera. If you don't follow those certain like really strict requirements, you have to notify the local health agency within 48 hours. I mean, they're very clear guidelines as to what you need to be doing. So, just the fact that you have an outbreak necessarily isn't going to get you in trouble. And a lot of times, I mean, I just had one case where they had a quote unquote outbreak, but they had 4 people that got tested positive within that 14-day window, but they all worked at different buildings. So we could, in good faith say that wasn't quote unquote an outbreak because they all were within certain workplaces. But then you have to have the question, okay, well, we just got notice that some people are tested positive for COVID, but it's been the holidays and so they haven't been here. Do we need to make these notices? Do we have to send these notices out to the workplace? And the answer it would be, well, no. It depends on the facts, obviously, but if they haven't exposed certain people within the workplace simply because they've tested positive, doesn't mean then that it's triggered a lot of your notice requirements because they weren't there infecting people at your work. So what we did there was we made sure that we notified them of the requirements and then we CC'd their union representative because you want to make sure that you're on the right side if you guys are dealing with any unions. There's a certain notice that needs to be go to the unions if there is an outbreak. So you just need to be careful about that.
Yeah, I was thinking like construction sites, like if they all get them somewhere else and they just happen, like if it's coincidental, then why would you penalize the workplace?
Yeah. No, they just need to be in the know about what their requirements are and they need to follow them.
Okay, thank you. And when you say the 14 days is 14 calendar days, right? So 2 weeks, not business days.
Correct. Yeah. Okay. Calendar days.
I have a piggyback question on that. And this is the what if. We have all these what ifs, what if in our business, mental health, so there's HIPAA, confidentiality, all these things, a client informs a therapist that has done an in-person that they have COVID now, and they've been in session with them in that time frame. Are we supposed to report that? Or is our responsibility only that we report that our employee, but we're going to have to take precautions because that was a direct exposure?
Right. So your employee has now has a known exposure to COVID-19. And then any other of your employees that would have potentially come in contact with that patient would then also have to be kind of roped in. If they had that more than 15 minutes, that kind of, meet those criteria, then you would need to provide notices to them. You need to offer testing to them. And then if it was more, then it becomes broader. If there's 3 within the 14-day period and you have a quote unquote outbreak, then the requirements are much greater. But if it's just and then if that one person tests positive, then, you go from there.
So we don't have any responsibility on the client or patient. Our only responsibility is with our employee.
Right, under these regs.
Okay.
Are you thinking, Sarah, I don't know if this is what I was thinking, but I was thinking it, a scenario where you treat like a family, like let's say, dad and son, and then like the mom, and then that the mom has it, like do you tell that dad and son who also go to therapy at your place? Like, is that what you're thinking? No,
I don't even know if I want to start thinking about all those, but even a vendor, like what if a vendor comes into a company or an independent contractor, or it's still, and they tell us, we just have to do with the information internally.
But also, let's say if you had a COVID-19 employee and the independent contractors are working in your facility, and would have been exposed to her, or that the FedEx delivery person comes in and has that level of exposure, that's on you to contact them, and that's part of your investigation.
It's part of the tracing. Okay.
Yeah. So who did you come in contact with, and then it's on you, and you're obligated to then contact those companies or those individuals that would have been there and been potentially exposed.
And it would be our obligation if an employee, who in my case would be a counselor, came up positive, do we have to contact all the patients that they were exposing?
Yes.
Okay.
And you can keep the identity of the person confidential. So, to the extent you can, and because you're needing to engage in this contact tracing, I mean, there's going to be some sort of, people are going to sort of probably figure it out a bit, but you can keep it confidential to the limits that you can.
So the employer is in charge of the contact tracing. Like, is there anything beyond that? Like, do they have to contact the county and say, hey, I had an outbreak, or like, how does that work?
Yeah, so there is a notice requirement within 48 hours if you do have an outbreak that you have to tell the county health office. And so there's a notice that's sort of a template notice that's all in that packet to the county office, and then also to any outside individuals and to the union representatives if there are any. They're all in there, all the required notices. Yeah.
Oh.
But yeah, I've seen very few laws like this that came down so quickly and are so onerous and so expensive on employers who are already suffering, to put these types of burdens on them, and to make it so that they have to turn things around so quickly. I mean, you're given a day to respond. I mean, it makes it pretty unworkable for so many employers. So
maybe you said this, but are we required to require vaccines, or is it still an option for the employee?
We have considerations for both mandatory and voluntary vaccinations. Voluntary is probably the most conservative route to go, and then also then you would need to make sure that you work with them if there's any accommodations. You need to treat that as if any other disability.
Okay, I'm thinking.
One more question,
Yes.
please, if I may. Actually, two. One, I was wondering, Patrice, has there been much discussion given to how generalizable these laws may become for other infectious diseases?
In what respect?
Well, are we going to apply this to other viruses?
We could. I mean, I think so. I mean, I think right now this is narrowly tailored to COVID-19. But I know in like the vaccine language or disclosures that we're drafting right now, that we are extending it to the flu vaccine or to other vaccines to say that the same type of communication is the same. But I mean, even now we've seen this virus mutate, right? I mean, so it is sort of a moving target and something that Cal-OSHA hasn't specifically addressed yet, or any of the other laws. I think we're just still trying to get our feet under us with COVID-19. But I would imagine, I mean, this would be kind of a good groundwork for any future viruses that we have. I mean, I think we're all learning a fast education, right, on how to respond to airborne viruses. But.
Okay, thank you for that. And the second quick question is, talked about the employer responsibility for providing face coverings, and there's different types of face coverings. And right now, more so than in past months, the higher protection offered through the N95 mask is more readily available, and I don't think the supplies are in as short supply for healthcare professionals. But in order to wear an N95 mask, it has to be fit tested. So the question is, if the employer were to make the N95 mask available, is that only sufficient if it is accompanied by fit testing? Or does not the N95 mask inherently provide more protection than other types of surgical and or procedure masks or cloth face coverings, and should they not be made available even without the fit test requirement? Has that issue come up at all?
It hasn't. The issue of, and I hear your point. I mean, the issue has come up about, well, can people supply their own masks, right? Can they come in with their own private masks and wear those? And the answer is a little bit unclear. The regs don't specifically address that, but I think the conservative approach is, if you have a standard mask that you feel is going to keep your employees safe and you protect it as employer, you can mandate that your employees wear those masks while they're at your facility, if you think that that's going to be greater protection. But the regulations themselves don't specify. They just say that masks are required and that face shields won't suffice, and you can't replace masks with testing.
Thank you.
Hey, David, can I weigh in on this one for you?
Sure, Rob, thanks.
Sure. So we approached OSHA on this to find out, because we, like you said, it seems like, hey, if I can throw you and say, wear an N95 mask, it's better protection than the surgical mask. Can we require that and waive the fit test requirement and the medical clearance too? I mean, it's not just a fit test, it's medical clearance, right? And they said, no, sorry, our hands are tied. You have to still follow the regulations. However, what we found was medical use masks, which are not NIOSH rated, and therefore I can require that of somebody, which we have found give as good a protection as N95, and you don't have to have a fit test for.
And is a
medical use or medical clearance.
Is a medical use mask the same as a surgical mask, or is it?
No, this is a surgical mask. Medical use masks look very similar to the N95 and have a better fit, right? But they protect not just what's going out. Like, this doesn't protect what's coming into me as well, right? I'm dropping out the particulates that I'm expelling, right? So I'm protecting you when I'm wearing the surgical mask. This has enough filtering to it that it protects you, the wearer, from what's out there in the air that you're pulling in. And it has a tighter fit than what the surgical masks do.
Okay, I appreciate
so
that.
what we've done is said, everybody's got to wear this normally. Less than 6 feet, you need to put one of these on. So like the guys that are at the warehouse or having to pick up some boxes, move heavy equipment where it's a 2-person job, you put this on before you're there. Any amount of time. I'm talking less than a minute. You put this on instead.
Because, and a quick follow-up, a surgical mask can look very, very, very similar to a procedure mask, but there's different levels of protection. And so when you say surgical mask, you are strictly talking to those that filter out that higher degree of particulate than a procedure mask with less layers of protection, correct?
Yeah, we're talking, these are, when we buy these packets, they're, 100 to a packet or whatever, in a bag, whatever, and they're labeled as surgical mask.
Got it. Very good. Thanks. I apologize for that tangent, but thank you very much for the information.
Yep.
Perfect. Patrice, just one last question. If let's say you're an employee and you are exposed, and then you go out, you test negative, can you come back to work?
So no, under the regs, if you've been exposed, you're mandated to be out for 14 days.
Even if you tested positive? I mean,
Especially-
negative. I'm sorry. No. Sorry. Negative.
Yeah,
And if
no,
Even if you
show no
tested negative.
symptoms, though.
Yeah, no, it's still that's still the requirement.
Okay. That's all I have. Anybody else? Patrice, thank you so much. We are. I wonder if you could put your contact information on the chat here. Some people have been asking for it, and then if you can send your presentation to me so I can distribute it to the people, all the RCBA people here. This has been great information. There's so much out there that was put out with COVID. We're constantly checking on the trends and everything that's going on that. We need to go back to, okay, how do we come back to work? So this has been great, and we feel like everybody should know about this more. But if you can just put your contact information.
I tried to and I messed up, so let me put it in there.
Oh, okay.
Okay.
And are we able to preview that packet before purchase?
Yeah, I can let you know what's in it, like everything that's contained in it. Absolutely. Let's see. Yeah, sorry, I feel kind of salesy. I don't mean to. I'm like the last salesy person in the world, but I just know that this has been so helpful for people because it just is like a kind of a here you go way to address this problem, which has become so hard for everybody.
And I think so many business owners we're trying to be experts in everything now. There's no way. So the help is really great, Patrice. Thank you.
Exactly. It will save you a lot of time.
So I just put up there my email address, my cell phone number, and then my work number. So if anyone wants to reach me, they can reach me that way. And I'm happy to answer any questions. I'm sorry?
Perfect. No, and before we close, I also wanted to let everyone know that Patrice will be back at the end of this month with a full-on legal update on just further legislation on many different topics that took effect for this year. So we do have it in our calendar. It's a legal update for California employers, and that's going to happen, I believe, January 22nd. I believe it's a Friday. So you guys are all invited to register for that one. And then, just like we did today, Patrice will be touching on those laws that came into effect that, every employee should be aware of.
Yeah, they were busy. Yes.
There's a lot of stuff going on.